Hello and welcome to UMCC Medical Consultant Connectors, where your health is our utmost priority. We are your trusted source for the latest in medical knowledge, bridging the gap between healthcare professionals and the wealth of information out there. Our focus today, alkylamines. These intriguing compounds play a significant role in medicine, their uses and impacts diverse and far-reaching. So grab a cup of coffee, sit back, and stay tuned as we delve into the world of alkylamines, a class of drugs that is both fascinating and complex. Alkylamines are primarily indicated for their antihistaminic properties. This group of drugs has been a game changer in managing conditions that can range from mildly irritating to severely debilitating. Let's take a look at some of the common uses. Allergies, those pesky reactions our bodies sometimes have to seemingly harmless substances, are often kept in check with alkylamines. They help in reducing symptoms like sneezing, itching, watery eyes, and runny nose. But that's not all. Have a cold? Alkylamines can help manage those symptoms too, bringing relief from congestion and discomfort. And for those battling insomnia, certain alkylamines are also utilized as sleep aids, offering a more restful night's sleep. Despite their versatility, it's important to remember that these are potent medications. They can have side effects and interactions, which is why their use should always be under the guidance of a healthcare professional. While alkylamines have a wide range of applications, their use should always be under the guidance of a healthcare professional. Understanding how alkylamines work in the body is crucial to their effective use. Let's first delve into pharmacodynamics, the science of what the drug does to the body. Alkylamines, a class of antihistamines, work by blocking histamine receptors in the body. This action prevents histamine from exerting its effects, thus alleviating symptoms of allergies. Now let's talk about pharmacokinetics, or how the body processes the drug. After ingestion, alkylamines are absorbed from the gastrointestinal tract, metabolized by the liver, and excreted by the kidneys. The onset of their action is typically within 1 hour, with peak effects occurring between 2 to 4 hours. Of course, individual factors such as age, weight, and overall health can affect these processes. For instance, elderly individuals or those with liver or kidney disease may process alkylamines slower, leading to prolonged effects. With their unique pharmacodynamics and pharmacokinetics, alkylamines are a powerful tool in the healthcare professional's arsenal. As with any medication, alkylamines can interact with other drugs and cause adverse effects. It's crucial to understand these potential interactions to optimally manage your healthcare. Alkylamines can enhance the effects of antihistamines, leading to increased sedation. Similarly, when mixed with alcohol or other sedative drugs, the drowsiness can be intensified. Now, let's talk about adverse effects. Common side effects include dizziness, dry mouth, and blurred vision. In some cases, individuals might experience nausea or constipation. It's also worth noting that alkylamines can cause an irregular heartbeat in certain individuals. Of course, these side effects don't occur in everyone, and the benefits of alkylamines often outweigh potential downsides. Nevertheless, it's important to be informed and to communicate any unusual symptoms to your healthcare provider. Awareness of these possible interactions and adverse effects can help ensure safe and effective use of alkylamines. Special care is needed when considering the use of alkylamines during pregnancy. Alkylamines, while beneficial in certain medical scenarios, must be approached with caution during pregnancy. This group of compounds can cross the placental barrier, potentially impacting the developing fetus. Studies have indicated an increased risk of minor congenital abnormalities when these compounds are used during the first trimester. As such, their use should be limited to situations where the potential benefits outweigh the potential risks. In terms of general safety, it's crucial to remember that proper dosage and administration are key in avoiding adverse effects. Overdosage can lead to symptoms such as severe sedation, agitation, and cardiovascular disturbance. Therefore, always follow the advice of healthcare professionals and adhere to the prescribed dosage. Moreover, alkylamines can interact with other medications, potentially altering their effects. Consequently, always inform your healthcare provider about any other medications you may be taking. Remember, while alkylamines can be beneficial, they should always be used with caution, especially during pregnancy. To wrap up, let's revisit the key points about alkylamines. These compounds have several potential applications as indicated by their pharmacodynamics and pharmacokinetics. But remember, interactions and adverse effects can occur, so caution is advised. This is especially true during pregnancy. The overall message is this: while alkylamines can be a useful tool in healthcare, they must be used responsibly. Thank you for joining us today at UMCC Medical Consultant Connectors, where your health matters to us. We encourage you to like, subscribe, and share our videos to help spread this important information. Stay safe and healthy.